Hello, everybody, and welcome to Medical Center Hour for those of you who are in the room and for folks on Zoom. I'm Donna Chen, a professor of psychiatry and public health sciences, and faculty with the UVA Center. Is that right? Okay. With the UVA Center for Health Humanities and Ethics. Today, we are really excited to be hosting two ethics professors, both associated with the center, Professors Lois Shepherd and Margaret Mohrmann, to discuss their work and their new book on the ethics of welcome. Before I introduce our speakers, a few quick thank yous and logistics for those of you who are interested in claiming educational credit. Hopefully you've seen the slides circulating before or the flyers at the door. The code to claim credit is 3091. Again, 3091. And you have up to 7 days after the event to claim it. If you have any questions, reach out to Charlene Kaufman. Finally, we plan to have time for Q&A following today's talk. For those of you on Zoom, excuse me, please use the Q&A feature on the webinar, and I will help moderate and monitor the Q&A. There'll be a microphone circulating for those of you who are in person. Also, following today's talk, there will be an opportunity to purchase Professor Shepherd and Mohrmann's new book, Welcome, Patterns of Moral Life, from the UVA bookstore, for those of you who are interested right outside the door. And now, to introduce our speakers. Margaret Mohrmann, MD, PhD, is Professor Emeritus of Pediatrics, Medical Education, and Religious Studies at the University of Virginia. She is the author of two prior books, Medicine as Ministry and Attending Children, and co-editor of the book, Pain Seeking Understanding, along with numerous journal articles and book chapters. Lois Shepherd, JD, is the Wallenborn Professor of Biomedical Ethics in the Center for Health Humanities and Ethics at the University of Virginia, where she's also Professor of Law and Public Health Sciences. She is the author of the book, If That Ever Happens to Me, Making Life and Death Decisions After Terri Schiavo, and the co-author of a leading legal case book, Bioethics and the Law, now in its 5th edition, as well as numerous academic articles on topics related to law, medicine, and ethics. In this presentation, Professors Mohrmann and Shepherd introduce their groundbreaking work on an ethics of welcome and describe the practices and perspectives essential to being a welcoming healthcare professional. Drawing on their recent book, they explain why welcome matters in healthcare practice and how we can get better at doing it. For welcoming, they claim, is in fact the primary move of ethics that enables further ethical deliberation to remain anchored in the lived reality of the persons involved. Drawing on compelling stories that demonstrate both the effects of welcome and the consequences of its absence, and illuminate the obligation of welcome as it applies not only to individuals, but to communities, small and large, and to institutions and organizations, including healthcare systems. This presentation explores welcome's defining attributes of openness, attention, and responsiveness, in which and offers a variety of welcoming perspectives and practices, including nesting, in which becoming welcomed enables and encourages persons to become more welcoming themselves. So without further ado, I want to welcome Professors Mohrmann and Shepherd to Medical Center Hour.
Okay. I'm Lois Shepherd, and we're really happy to be here together to share our work with you on the ethics of welcome. I think the book came out in January, so very recently, and talk about the book and its theories and illustrations in connection with the work of health professionals. So I'm going to start by telling a little bit about the backstory of the book. So every book has a backstory. This work was a 15-year process. A wonderful experience in collaboration. And it started soon after I came to UVA in 2008. When I came to UVA, and Margaret was already the director of programs in the center, programs in biomedical ethics. And we realized pretty early on that we had a common way of approaching ethical issues, influenced by similar themes, the themes of welcome and responsibility, two different themes. And this was even though we came from very different backgrounds. So my background is in law, and Margaret's background was in medicine and in religious studies. And these themes had emerged in our independent work over the years before the collaboration. And I'd say there's another thing that I think that we had in common in how we approached our work, which was it was grounded very much in the practical. What should be done in this or that situation? Or more particularly, what should this actor do in this story? Whether the story was something we encountered in healthcare or medical education or something we read in the newspaper, what should this person think about? What should this person see or do? And we also leaned towards a virtue ethics approach. So as we were thinking about that, we were thinking, how can you be prepared? How can you be ready to respond appropriately to both the small and big ethical questions we face at every turn? So at first, we were writing a book that was tentatively titled Welcoming Responsibility, with equal weight on both themes. But we eventually came to see over the years that welcome was prior. Welcome being the orientation necessary before we know how to act responsibly, how to be responsible. We also realized that welcome was less fully explored, less clearly defined as an ethical orientation, and we set out to understand its many dimensions. Our book then ended up being a book about why and how welcome matters, and about how we can become more welcoming people. So even within this context, at first we thought we were writing a book about medical ethics. And a little over half of the stories, it's very heavily story-oriented, we present in the book relate to healthcare in some fashion. And we'll focus on some of those today. In medicine, the effects of welcome are obvious. The failures are obvious. This is true in the ability to make an accurate diagnosis, fashion a treatment plan, communicate well with patients, know what the truth is that needs telling, and figuring out what kindness and respect are asking of healthcare professionals. But ultimately, we claim in the book that welcome is owed by everyone to everyone else all the time. So not just a book about medical ethics, between teachers and students, cashiers and customers, between strangers and people who have known each other their entire lives. So we start off the book in defining welcome, and we're going to share here the table of contents. So this is what part one of the book is about, defining what welcome is. And we talk in this part about how welcome is about openness and responsiveness and action. And you might notice patterns 4 and 5, we call them patterns instead of chapters, about which we might be able to talk in the Q&A. But patterns 4 and 5, step into the room and stay a while. That might resonate with you in thinking about healthcare and how healthcare shapes this work, about which we'll talk more. Much of what is contained in the first 65 pages or so of this part, which is what this part is, can be summarized by the simple statement: to welcome someone is to say and mean, in effect, I want you here.
I want you here. Welcome is a strong declarative statement of intention. I want. It is a strong declarative statement of attention. I want you specifically, not generically, you as you are. And a statement of presence. I want you here with me now. More generally, I desire your presence in the world. The intention part of this statement, the intention part of welcome, is evident in the etymology of the word welcome. The W-E-L part of that word doesn't mean well, it means will. Welcome is not a Latin word, it is a Teutonic word. And so it becomes evident when you look at the German equivalent of welcome, which is willkommen. Your coming is in accord with my will. I want it. I desire it. Then the centrality of intention in welcome. leads us to understanding welcome, understanding being welcoming as a way of being, a way of living, of moving through our lives. In which it is our settled intention, the way we want to live, to be in open attentiveness to the persons we encounter. That's what it means to be a welcoming person. Open attentiveness both to people we already know, the folks we've known forever, and to the folks we're meeting for the first or maybe the second time, a new patient, a staff member, the cashier at the grocery store, the plumber who comes to our house. It's about intention. And part of a welcoming intention for each person we encounter is to see that person, the you in this statement, to see you as the unique person you are, not as I expect or assume or need you to be. And this focus requires that we be open to seeing, to learning who this person is, letting them show us, letting them tell us who they are, which may at times mean setting aside our assumptions. It may mean setting aside our tendency to stereotype, to assign people to categories. You know the categories: diabetics, drug seekers, homeless, elderly, right? Setting aside our tendency to make assumptions, our tendency to stereotype, and in some cases, setting aside our aversions. And that makes this a good time to make the point that welcome is of persons. It's not of characteristics or details or situations. We welcome a person who is dying. That doesn't mean we welcome death. We welcome a person who's in prison. We don't have to welcome what they did to get there. I intentionally welcome you as you are here in this place at this time. And therefore, I need to know who you are right now, not historically in the chart or as I've always known you to be or I might expect you to be at any time, but right here and now. With people we've known for a long time, for example, family, friends, patients we've been seeing for many times. Of course, we draw on what we've come to know about them, but we also pay attention to what's going on right now. I learned via a poem that the Japanese sign language gesture for good morning is this. What this is pulling down the string that turns on the light. So when we welcome someone, we turn on the light of our attention, so we can see each other as we are in this moment. And all of this taken together means I have to do things. I have to intend. I have to be open. I have to attend. I have to respond. Welcome requires action.
This is the part I think that helps us distinguish welcome from things like empathy or compassion, because welcome implies actions. We cannot simply be empathetic or compassionate to have internal thoughts of welcome or understanding. We have to respond, and responding requires action. In fact, we describe welcome in many ways. It took a whole part to define welcome. We describe welcome as responsive action. Okay, but how? What does it mean in terms of action? What it requires is very dependent on the particular situation. That's what the paying attention part helps us to discern, and the stories in the book help to illustrate. But there are some key points we can talk about briefly here. First, it's not aggressive. Okay, so think not of a handshake where like you've thrust your arm out towards someone, but a more receptive gesture, opening ourselves to the other person. This image also helps us make the point that the obligation of welcome is owed to the person in front of us. Being a welcoming person does not mean, and we in no way suggest this in the book, that we have to go around trying to find people to impose our welcome on, right? That we have to go around in a room and shake hands with everybody and be beaming extroverts. That's not what it's about. It's about responding to the person in front of us. Now, how do we know if we are responding, right? The key here is that we have to move, right? So welcome is also physical. It requires a physical movement. It's not static or passive. requires something from us more, like I said, than internal thoughts. That movement can be as subtle as eye contact. It can be as subtle as a nod of acknowledgement, to something more complex, such as offering needed assistance or affirmation. The movement that welcome entails causes us to come into proximity, physical or virtual, with the other person, as the essential meaning makes clear, which is, I want you here with me and my proximate, right, near me. So we all know the difference between walking by the closed door of a patient room for whom we might have some responsibility, but wish for some reason to avoid, perhaps because we think incorrectly that there's nothing we can do. And we make the point in the book that there's always something you can do. Contrast that, the closed door of a patient room, to opening the door, sitting down, and staying. And so you can see here again, patterns 4 and 5. Step into the room, stay a while, invite the other person in. A closed door versus an open door. That's another image I think is helpful here. The last pattern noted in this definitional section of the book you can see here is welcoming ourselves. And it makes the point that everything we're saying applies also to the obligation to welcome ourselves as we are, recognizing our own needs and limitations, as well as aspects of our personalities or histories that can sometimes make welcoming certain persons difficult. We talk later in the book, in a different part, about paying attention to the obstacles in us to being welcoming and distinguishing between the ones we can and should learn to get past in order to be open to others, and the ones we may need instead to honor in order to protect our own real vulnerabilities. But first, here's a rather simple story to get us started, shared in pattern 2 of the book. How might one respond under an ethics of welcome to this case summary presented to one of us several years ago for commentary? JR is an 84-year-old man with moderate dementia and significant heart failure who has an aggressive renal tumor. The answer is that we cannot yet respond to the implicit question, should there be surgical intervention? We can only react, because the person who is identified here as JR remains unknown. We do not even know his name, much less anything about his personal history or about what he wants or what he values. We're used to this abbreviated way of describing cases, with a patient identified by initials only and a situation encapsulated in brief terms, in order to engage in the abstract reasoning that ethical case considerations sometimes ask for. But eventually, our moral obligation is not to an abstraction, like JR, but to a person with a name. So let's call him John Rimbert. Our moral obligation is to John Rimbert. There's more about him that is to be known, that has to be known if we're going to care for him well. If all we know about JR are these three pieces of information, then all we can do is react. And we make a point in the book about distinguishing between reactions and responses. Reactions are reflexive, hasty and unthinking and generic, only loosely connected to the actual person to whom we are reacting, and more likely arising from something in us. Associative memories, habitual stances, and so on. Reactions are unlikely to be welcoming. Our moral obligation is instead to respond to this person in front of us. And to do this, we need to develop the perspectives that are offered in part 2 of the book.
So one of the challenges we found in putting this book together was how to organize it, because the book itself is nonlinear. Everything sort of feeds back on everything else. And so the book ends up being nonlinear itself, but it does have a flow. These are the parts. We've been talking about part 1, about what welcome is, the definitional stuff. In part 2, we talk about forming welcoming perspectives, ways of seeing, ways of attending. And in part 3, start embellishing that by talking about welcoming practices and the value of practices, ways of paying attention, ways of training ourselves to pay attention. And all of that raises inevitable questions about persons we'd rather not welcome, or persons who don't want, who reject our welcome, and raises that question of how far do we have to go? But in that part, we not only talk about persons we'd rather not welcome, but also talk about expanding our grasp of this concept beyond one-on-one interactions, beyond individual responsibility, to consider the ways in which institutions like this medical center are or are not welcoming, or do not support our efforts to be welcoming. So let me start off talking about perspectives, part 2. Very simple, almost minimal sort of reasoning here. Seeing a human being, JR. Seeing this human being, John Rembert, who this person is right now, today, in this situation. It's fair to say, and you will hear this all through our talks here, that welcome is all about paying attention. The work of welcome requires sharpening our attention so that we learn to consistently see the person and not the stereotype, to see the individual and not the generic. So welcoming someone means seeing them as human, and that sounds dreadfully obvious, except I expect that each of us can come up with some example of when that didn't happen. So seeing someone as human, but then also seeing them in their own particularity, which we can only see if we pay attention and at times just ask curious questions. Tell me who you are. I gave a talk on this topic at a medical center in Boston several years ago. And during the Q&A, a nurse stood up and asked this truly poignant question. She said this: "My patient weighs over 600 pounds. He has cellulitis. It's his own fault. I have back trouble. How can I welcome this patient?" Well, one important answer is that she must be able to rely on the institution in which she works to be sure that taking care of this patient doesn't put her back at risk. She has to be able to rely on her employers and her colleagues to provide the assistance she needs. But that would only take care of her back. There's more going on here, a lot more, including stereotyping, maybe an unexamined aversion, possibly some story she's told herself that leads her to label the cellulitis as his own fault. Indeed, how can she be welcoming toward him? Well, by paying attention to herself first, keeping her back safe, but then by setting aside her stereotyping and imagined story, not beating herself up about it. We all do this. We do assign people to categories. We do imagine stories about them, but we can recognize we're doing that, step around it, and then reconsider him. Take a second look. She can remind herself that an obese body is not all he is, and an aching back is not all she is. Everything about a person matters. So who knows? With a second look and a few curious questions, she may find that they share a love of a particular TV show, or they went to the same grammar school, or just like her, he's the person in his family that everyone comes to for support and advice. That is, find some way for the unique person that she is to connect to him as the unique person he is, so that she can welcome him, not his weight, not his skin, but him, the person he is. And asking these curious questions, finding something to like, all of these things are part of welcoming practices that we recommend in part 3. And there are a lot of them, right? Let me just pick out a couple that I think are worth mentioning. 18 and 19, come as you are, let others come as they are. It's all about paying attention to the way we present ourselves, how people react or respond to the way we present ourselves, and about how we react to the way people present themselves. 21, my own particular favorite, worry less about being manipulated, right? 22, being open to interruptions, being aware of the dangers of routinization, the way that routines interfere with paying attention and skew our moral compass. So, but the one I'm going to focus on in the next few minutes is number 17, paying attention to names. It's a simple practice. It's one we've already alluded to in making the distinction between J.R. and John Rembert. But it's also a mode of welcoming that's easy to get wrong because it really does depend on our intention and our attention. Names are who we are, and whether and how we use them well in our encounters with others is a major way in which we do or do not show our respect for them, and in which we do or do not show that we hold them as persons of equal value. Now, there's no way around the fact that in the healthcare system, there's always a significant disparity, a significant inequality of authority. People come to healthcare professionals because we have a certain kind of knowledge, we have certain skills, and the power to do something with that knowledge or those skills on their behalf. Like declare a diagnosis. Your cough is bronchitis, not lung cancer. Right? Or write a prescription or do a procedure. And in the face of that inescapable inequality of authority, it becomes even more important to maintain respect and the assurance that we are all of equal value, regardless of credentials or titles or authority or experience or anything else. And how we use each other's names is an extraordinarily important way in which we do that. See if you may be able to relate to this story. It's a story about me. Several years ago, I was walking to the parking garage after teaching a late class. I tripped, smacked my face on the pavement, and had a laceration in my forehead, end up in the ER to have it stitched. None of the three nurses introduced herself. Two of them called me Margaret. The other one didn't call me anything. The resident came into the cubicle, didn't introduce himself, didn't call me a thing, asked a few questions, did a slapdash neuro exam, and then started getting ready to stitch up my forehead. And I said, if you're going to be sticking that needle in my forehead, I want to know your name. And he laughed and said, I'm Dr. Edwards, Margaret. Now, let me be really clear. The problem is not that I was not called Dr. Mohrmann. They might not have known that. It's not on the first page of the chart you get in the ER. Nothing to suggest that I was a physician, right? That's not the problem. The problem was that I was either not addressed at all or addressed only by my first name. The issue is about attention, and it's about striking a balance. That's how you show respect. That's how you show equal regard. If he is Dr. Edwards, I am at least Ms. Mohrmann. Or you can even offer me the choice. Hello, Ms. Mohrmann, I'm Dr. Edwards. Do you mind if I call you Margaret? Perfectly all right. Well, now this happened, I think, about 25 years ago. And things are better, right? I mean, we have spent a lot of the last 25 years teaching students about how to introduce themselves to patients, right? I spent a lot of my time doing that, at least. But a year ago, I had my knee replaced. And in the recovery room, a person came bounding in with a great beaming smile. I later figured out that this person was a resident on the orthopedics team. And this person said, is it Margie or Margaret? And I said, well, that depends. Who are you? And his answer was, I'm Dr. Jones. And I said, well, I'm Dr. Mohrmann. Now, maybe I wasn't very welcoming to either of these docs, but we also have that pattern about welcoming ourselves. And when you're not feeling respected, it's okay to respect yourself. In these stories, I had to welcome myself. So speaking more about respect.
Well, we've said in the beginning that everyone is obligated to be welcoming to everyone all the time, you know, from the little to the small. So it seems like the names may be a small point, but we think everything in our everyday lives matters. So you might be wondering then if the expectation, since we have this obligation, moral obligation that comes before in medical ethics, if you're going to analyze a problem in any way, using any kinds of theories of ethics, we say welcome comes first. And if you have to be welcoming to everyone all the time, you might be wondering if the expectation is that you have to be a welcome mat. So we encountered that comment and that reaction from a group of medical students in an early presentation of this work. I don't have to be a welcome mat. Now you can tell from Margaret's story that that's not the case. She was not a welcome mat. A welcome mat suggests passivity. And while an ethics of welcome can be costly and demanding, it's not passive. It's radically active. So I want to say the student's comment was hugely helpful to us because at the time we had not adequately thought about this grand statement we were making that you have to be welcoming to everyone all the time, about how far we have to go. Like, are there any costs? I mean, how do we recognize the costs of being welcoming, and are there any limits? And so we've worked really hard on this last part. This was the hardest part of the book to write. How far do we have to go? And in this part of the book, we get into much more complex issues. We had addressed, for example, aversions we may have to certain people. We describe some of these aversions as protective. I've alluded to that earlier. Necessary to protect ourselves and mean our obligation in those situations to be the one who's offering the direct welcoming actions may be limited. We posit that there are very few protective aversions. That should be a small category. More likely, our aversions to welcoming certain people are remediable, ones that we can and should get over. We write in this part of the book about how one might welcome patients who are murderers or neighbors who are sex offenders, and how no one is unworthy of being welcomed by someone. Is it me, we should ask? Can I welcome this person? And part of the answer to recognizing and setting limits within an ethics of welcome is sharing the responsibility of welcoming. If I cannot personally welcome someone, can I share that responsibility with others? If I have a protective aversion, something I need to do to protect myself, can I share that responsibility with others? And if not me, then who, right? Who can help me in welcoming him? So let's focus for the moment on a patient who appears to be bigoted, who is acting in an overtly offensive manner to oneself or one's colleagues. And in fact, it was a story one of us shared about an apparently racist white patient that prompted that student's welcome mat comment years ago. The class session and comment took place following the white supremacy events in the summer of 2017 that culminated in the Unite the Right rally in Charlottesville. And during that time, there seemed to be, we found in the health system, either there was really happening or we were noticing it, I'm not sure, a rising number of patients, increasing number of patients who were making offensive comments or even refusing to be cared for by certain healthcare professionals on account of race, ethnicity, or religion. So how can one offer or continue to offer welcome to an overtly bigoted person or patient? This is tough, right? To be sure, does not require you to be a welcome mat. Now, there's much to be said about this. For example, the perspectives and practices offered in parts 2 and 3 of the book, we've already looked at those tables, those patterns in the table of contents, might require us to ask some of these questions. Have we reacted too quickly in the circumstances? Why might we ourselves be engaged in stereotyping? Have we directly confronted the behavior, allowing the patient to possibly reset and act more appropriately? Thus welcoming both ourselves or our colleagues and the patient. But we also in this book talk about the responsibility of institutions to be welcoming. Welcoming of the people who are employed by them, welcoming of their customers, their patients with respect to healthcare systems, welcoming of everyone. How can the institution respond to the apparently bigoted patient and the people who are tasked with taking care of them? This is a crucially important question. And we find the answer in a number of places, but one is that knowing that we ourselves are welcomed is what makes it possible for us to be welcoming. And this is the idea on the cover of the book, this idea of nested welcome. So knowing that we ourselves are welcomed by others enables us to be welcoming. For the medical student, so for example, with our bigoted patient example, for the medical student who is the target of bigoted comments from a patient, we should ask, what does the resident do, right? If the resident is the target of the offensive comments, what does the attending physician do? What institutional backing does the attending have? Who is speaking up and how? What does the institution systematically do to train and enable people to respond in the moment and afterwards? What are the institution's policies to address these situations? So in a lot of the book, we talk about one-on-one encounters between people and the idea of welcome in that context. But we also talk about how welcome is an obligation that has to be followed when we're even thinking about policies that are going to affect people we don't even ever personally meet. They are still the person in front of us if our policies are going to affect them. We are happy, we have to say, to have observed concerted efforts by UVA Health in the aftermath of the Unite the Right rally to try to create an environment supportive of employees, faculty, students, and trainees so that those workers could step forward to welcome all patients and colleagues. So there was a lot of work that was done during that time. This was a wonderful example of an institution being welcoming of the people who work there, which enables them to welcome others. Everything together that we're talking about today, from those small things about how to use names appropriately and to think about it, to at least try, to how you would deal with a bigoted patient, springs from and creates a fundamental view of the world, which is the title of one of the final patterns of the book. And this is what we say in that pattern about that. In an ethics of welcome, the things we do, call people by their names, let people tell us who they are, invite the other person into our world, create a livable space of another kind, one in which each person in an encounter can be appreciated and valued, where everyone can be at home. And that's the essential idea of the book, this fundamental view that permeates our lives every day, the how and the why of welcome. And now I think we'll turn over to questions.
Okay. All right. Thank you. So one question was, if you realize or come to see that you are not welcoming, and you feel sorry about it or regret it, what is there to do?
Is this after? Are you still in the situation? I mean, wouldn't that matter? Like, is this a? I guess I'm wondering whether this is a situation where the person is no longer in front of you. You have no further connection to them at all, right? And that's going to be a tough thing. I don't think so much. All of these things are very much about the particular facts of the particular situation. Would it be appropriate to reach out again? Probably. In many circumstances, it would not be, right? It would not. That would be intrusive. If now you're trying to go run back after the stranger that you were not welcoming to and say, I think, right? Then that seems more like it's about you, right? And imposing your welcome on someone. So if it's that kind of situation, it seems that it's about reflecting and learning from it, right? And so one of the things we talk about in the book is practice. How can we be prepared? And I think one of the ways we can be prepared, and I know during the process of writing this book, there were tons of times where I would reflect on an encounter that I had had, and whether it was with a stranger or with someone I knew, and like, I didn't do that well, right? And so how could I do better next time? So I think it is a constantly reflective practice. You want to add something?
I agree with all that. And one of the important things, I think, is that we have to forgive ourselves. That's part of welcoming ourselves, is we're not perfect at this. It's one of the things that Lois and I realized over 15 years of working on this book is realizing how we've changed as we've talked about the practices, and we all have to start somewhere. So forgiving ourselves is a really important part of this. And I think there are times when it's appropriate to go back to the person, either right in the moment or the next, if it's a patient and you're going to see them again, to be able to say, I'm sorry, I was fairly brusque with you before. I wasn't paying attention. Can we start over? To say something. It's another way of connecting with someone else. I'm a human being also, and we can connect in this way, just being real about it. And yes, knowing that we all have to practice.
Yeah. And I'd add something to something that Margaret said made me think about this, is we say several times in the book, because we say it's not about judging anybody, right? When we fall short. So we have put forward this really, really demanding ethical orientation and obligation. But then that doesn't mean it's about saying, well, you're not adequately welcome. You're not adequate. You're unethical, right? It's not about that. When we try really hard and not to do that. And it's not about judging ourselves either, but kind of a little bit it is. In the sense, if you're going to be reflective, right, then you have to be willing to examine and say, I could have done better, right? Even though you could be generous with yourself. Yeah.
So I'm hearing in part, kind of reflecting on the interaction, but also forgiving yourself and learning from it. And it sounds to me like some of the contextual issues are whether there is a relationship to continue or something that's going to continue happening, even if maybe that particular encounter is over. And that would be important in thinking about what one might do.
Okay. And I would say a part of the process of writing the book, so we would meet at, most of the time we met at Sivo Coffee. Big shout out to Sivo Coffee. They were great. And we would meet many, many times, like once every 2 weeks or something, and trade drafts. And a lot of time, and the stories that are in the book kept coming throughout the time we worked on this. And sometimes it would be, this happened, and I was uncomfortable, I was uncomfortable with what I did, or I can't figure out what was the right thing to do. And then we would, that kind of reflection, it might be something that happened to us or that we were part of. And it's just like, well, what would an ethics of welcome say about what I should do in the future with that situation?
It also sounds like dialogue with another person can be very helpful in developing the practices. So not just forgiving yourself. So it's not just an internal thing, but potentially would grow together with another person as you dialogue.
It certainly was for us in creating the book, but I think it's more generally true. I think the more we worked on it, the more we realized that welcome is a community project. That's part of what we mean when we talk about nesting, is that we're all sort of holding each other together in this work, and we can help each other do it better. You can turn to a colleague and say, I don't think I did that very well. What else could I have said? How could I, or before you go in, this is going to be difficult for me. You got any suggestions about how I can approach this person whom I'm finding really off-putting, but I want to be welcoming to them? Help me out here. I think there's a lot of room in that for welcoming that sort of communal effort. Right?
Yeah, great. Thank you. Feel free to join the conversation. John here has a mic.
Sure.
Wow.
But you got to be magnified, right?
First, my name is Mary Sullivan. I work at the Teen and Young Adult Health Center at UVA, and this is so important when you work with teens and young adults and their families. So thank you so much. I found my eyes welling up when you started, because I think this is so always needed, but particularly right now. So I just want to ask a very general question. What
inspired you to initiate exploring this and writing this book?
Can I tell the funny story? Do you know what story I'm talking
Nope.
about?
But I promised to laugh.
We'll all laugh.
Well, we were at the downtown mall. You remember this one? Having a glass. Margaret doesn't remember this. We were having a glass of wine, but
That's why I
just wine.
remember it.
And we were outside, and Margaret was there, and I was there, and my husband was there, who is a writer. And I was kind of new at VA, so the book didn't take off immediately from this. But we were just sitting there, and Paul had read, and I had read also, but Paul had read Margaret's other books, and it loved the way she wrote and the way she thought, well, the way she thinks is a lot about like the way you think. And so he said, you guys should write a book together. So that really, honestly, it was like, maybe that's a good idea. Okay, so what would that book be about? And I had been working, before I came to UVA, I had taken a class, I'd audited a class on contemporary philosophy, moral philosophy, and we had studied Emmanuel Levinas, which I was very taken with, although I can't actually read it in the original because I can't understand it. It's very, very complicated, but I had a good teacher. And he really focused on responsibility and this idea of welcoming in the face-to-face encounter. And Margaret had been working for a long time, and her work had been shaped by ideas about responsibility. And so we would find, I think, in conversation that we would be talking, those themes would come about when we would be talking about, something that happened that we were trying to deal with, either in medical education or in the health system. But that's why it took 15 years, because we didn't start out with an idea of what this book is going to be about. We really did finally realize, well, we think welcome is primary.
And I think the spark that connected all of that with us as we talked about things is realizing that we always came back to this point that it's the person you're interacting with that matters, that it's very easy, and it happens often for bioethics, medical ethics discussions to go abstract, to be about issues. And we kept saying, yeah, but what's that person saying? Who is JR? What does JR want? And everything we talked about, we kept coming back to that. And that's how we realized, I think, about the priority of welcome, that if first you have to see and be open to this person, the one you're encountering, the one you're trying to make decisions with, sometimes for, but hopefully with, that it just kept coming back to that interpersonal thing that I think, and every time we'd go off on some tangent, that's what would bring us back. That's what we'd come back to, is that spark. Yeah. Right.
Yes, wouldn't you have loved to be in the coffee shop with them, hearing them?
But there were arguments too.
Like, you can have welcoming arguments. So here is a question from one of the Zoom audience folks. And you talked a little bit about this, so I don't know when this question came in relation to when you talked about it, but it's always worth talking more about. Thank you. Such an important topic for all of us, clinicians and non-clinicians alike. I'm especially interested in the concept of welcoming ourselves, how this relates to both people in an interaction, the welcomer and the welcomed. Can you talk more about the relationship between welcoming others and welcoming ourselves? Are there examples of responsive action encouraging self-welcome for all involved?
Oh, you want to tell your story about the at the grocery store? About self-presentation?
Oh, sure. I could tell that. This is in the book.
Yeah.
I have, for most of my adult life, had the experience of persons I just run into briefly, like a cashier at the grocery store, calling me sir. happens over and over and over again. And I say, well, I wear my hair short, I'm big, and, okay. And mostly it was just irritating because the person, I just not say anything. The person eventually would say, oh, I'm sorry, and start apologizing all over the place and saying, I've had a hard day and stuff. And so I'd end up having to take care of that person. And mostly I just wanted to get out of there. But working on this book helped me recognize that part of what was going on is that I wasn't welcoming myself. I not only wear my hair short and I'm big, but I also am not conventionally feminine. I carry myself in rather androgynous ways and dress that way. And so when someone calls me sir, they're reacting to some cues that are actually there. And only when I welcomed that about myself and said, yeah, I kind of like being this way, I don't plan to change. So that meant that when someone called me sir, I had to say, basically, that's okay. And it happened one day. I just sort of responded to this, and it was another cashier in a grocery store, is when it always happens, who called me sir, and I just looked him in the eye, and when we started flustering, and I said, that's all right, and smiled at him, and you could see this relief over him, but the relief was in me too. This is who I am. So it was a matter of welcoming something about myself. And I think that also shows up in recognizing our own vulnerabilities, the things we are good at, the things we maybe aren't good at, maybe the things we can't do, sort of recognizing that about ourselves and giving ourselves permission not to have to do everything, not to have to be everything to everybody, knowing ourselves well enough. And I think, did you have anything you want to add to?
No, I think especially in the patterns about self-presentation, come as you are and let others come as they are. That really connects to this idea about welcoming ourselves and welcoming others. And then also when we talk later in the book about, there's a pattern called help others welcome you, which is like, okay, not only do you have to welcome people, you have to help them welcome you. It's just like, we're asking a lot there. So for example, and some of the stories we share there are stories where like a healthcare professional, 2 different stories, has been a recipient of offensive comments. And we've kind of tried to talk about, without judging the person, how can you engage with that person in a way that is both true to yourself and welcomes yourself, right? And doesn't indicate that kind of if it is offensive comment is appropriate, but lets you see maybe more about what is going on in that situation.
Right. That I think that welcome yourself enables you to respect yourself enough to actually engage with people who are being offensive. Instead of, our tendency is to pretend like it's not happening and just sort of paper, which is not respecting yourself, right? And as a result, you often don't respect your vocational obligations either, because you just want to get out of the situation instead of actually engaging and saying, that's actually pretty offensive. Is there a way we can get past this and keep working together and see what happens? So,
maybe you misunderstood.
Maybe you misunderstood. Maybe you said, oh, I'm sorry. I'm sorry. I just,
bad.
Yeah, it's part of my disease. I just blurt things out or something. Or, it's possible the person become even more offensive, at which point you can say, we can't work together. I'm out of here. I've been something like that. But at least to respect yourself enough to be who you are in that situation.
And it also sounds like to respect yourself to be who you are, but respect the other person enough to tell them what's happening.
That's a great point. That's a great point. And in the story we talk about, we say that it's a story where a patient makes what seems to be maybe a racist comment, and instead of just kind of blowing past it or getting out of the room quickly, it's actually respecting that other person to expect them to behave appropriately.
Right. To have expectations, to ask them
Right.
to be better than they sounded.
Yeah.
Right.
Patients have obligations to be welcoming too. I mean, that's part of the everyone all the time, right? So it's not just healthcare professionals are the ones who have to be welcoming. Patients have to be too, and it's part of respecting them to expect that.
And it sounds also like part of the welcoming is to give them the opportunity to maybe make a different choice.
Yeah.
Yes.
Yeah.
Yes, that's right.
Okay.
Yeah.
Yes. One we have.
Hi, thank you so much. You guys mentioned a little bit earlier that you call within your parts, they're patterns and not chapters. And I was wondering if you could talk a little bit more about what led to the decision to do that and what that means.
Okay, that's a great question. I think the idea of the patterns has basically two meanings. One is that these are the patterns that we see are things that you see over and over, right? Over and over. If you just open your eyes with an orientation of welcome, you will see these patterns all over the place, patterns of people behaving. And there are also patterns in the way we present them as models, kind of like, so each pattern, we start with an observation in bold at the beginning of the pattern, something about human beings and the world. And then we talk about some stories and illustrations and unpack it. And then at the end, and all these patterns are just like 4 or 5 pages. They're very short. It's a very readable book. At the end, we say, now go do this. Right. Okay, so this is modeled on the book A Pattern Language, which is a book from the 1970s. It's an iconic book about architecture and livability. I mean, it's a fascinating book, and I totally recommend it. I think it's on the little handout. And they use this kind of format also. But they're talking about what do you want a town square to be like in order to gather people? And then they'll give illustrations, and often they actually have drawings. And then at the end, they'll say, so create your town halls like this, build a sitting wall, and what height should a sitting wall be? And where do you plant trees? And what makes people feel sheltered by a roof? What's a sheltering roof feel like? So theirs is about architecture and livability, and we think our book is about livability also. And in fact, that phrase, a fundamental view of the world, comes from a pattern language, because their book about architecture is a fundamental view of the world. It's about how people live in the world. Ours is on the ethics side instead of the building, the built community, but it's also about how we can flourish together, living together. So that's a great question. Thank you.
And we are out of time. And thank you for asking that question. That was going to be my last question if no one asked it. So thank you, Professor Shepherd and Mohrmann, for such a great talk. And thank you to our audience. And this makes me miss having you around, Professor Mohrmann. Again, there's a representative from the UVA bookstore for anyone who's interested in purchasing the book. And I just wanted to give you a heads up that our last Medical Center hour for this semester will be next month on a Thursday, April 16th. And the center's Arts Research Fellow, Jess Walters, will be presenting some of their fantastic work in a titled The Art of Our Scars, Creative Applications of Patient Narrative in Clinical Discourse and Medical Education, a Kidney Transplant Recipient's Perspective. Thank you all for coming today, and thank you.